Hello, my name is Dr. Annique Hogan, and I am a complex care pediatrician here at the Children's Hospital of Philadelphia. I direct our inpatient complex care unit as well as our Compass Care and care management programs for children with chronic conditions. Today, I want to talk with you about managing respiratory and gastrointestinal illnesses and issues in children with AGS. And the principle I want to introduce is this concept that the perfect is the enemy of the good. This is a quote that is often attributed to Voltaire from centuries ago, but the message really still holds true now when thinking about the approach to managing both respiratory and GI issues in children with AGS. When we strive to achieve perfection in how we want to have these children tolerate their feeds, or having perfect weight gain, or having perfect respiratory status and perfect management of secretions, when the perfect is our goal, we really do lose track of the good. On this next slide, I want to introduce this concept of the importance of finding balance. So, with children with leukodystrophies, including AGS, it's really important to think about balancing the conditions that these and the issues these children have in these many different areas of their body, because they all do work together, and they can work against each other, or they can work for each other. And it's really important to try to strike that balance. It's also important to note that the point, your fulcrum there, is not always going to be exactly in the middle. Sometimes some issues are going to carry greater weight than other issues, and you need to counterbalance those accordingly. So sometimes the gastrointestinal issues are going to be more weighty than the respiratory issues, and vice versa. And you really need to try to achieve that balance between these issues, and knowing that these all exist together and are impacted by many of the other issues, including the neurologic issues that children with AGS are facing. So, when we move to the next slide, I want us to begin to talk a little bit about some of the gastrointestinal issues that we see in children with AGS. Starting here with feeding difficulties. So, we know that feeding issues are really so common to face. These can be issues that have to do with the difficulties with orally feeding, and very often there is a need for use of a feeding tube. It's important to remember, however, that using a feeding tube does not mean that we take away the ability to use the mouth. In fact, the feeding tube actually opens up the possibility to be able to focus on letting oral skills be about feeding for pleasure, for enjoyment, and letting things about the mouth, taking the pressure off of a feeding by mouth, so that we can still accomplish hydration and nutrition using the feeding tube, and let feeding be fun for children and for families for as long as it is able to be. It's also important to recognize that reflux is extremely common to face because of the neurologic issues that we know that we have, including central or axial hypotonia, or low muscle tone there. We know that reflux is an extremely common issue to face. Sometimes this reflux can be so severe that we need to use various medications to treat it, to take away some of the discomfort associated with reflux. Sometimes we need to think about the way that we are administering feeds to be a little bit more friendly to the GI tract, and to balance against some of the issues that the reflux is presenting. There are different feeding options we can do that can make the feeds less likely to be refluxed up. It's also important to know that children with AGS are often facing issues with gastrointestinal motility that is not normal. So, and this is not always entirely predictable motility as well. So sometimes the motility can be quite slowed, but other times it can really be quite variable. And this can truly affect feeding tolerance. Getting back to this concept of the perfect is the enemy of the good, we really do need to think about how we are administering feeds, so that we are trying to achieve the necessary amount of weight gain, not trying to achieve perfect weight gain, so that we can balance out the need for nutrition and hydration with the comfort of the child, knowing that it is possible to achieve that balance. It is going to take some modifications. We want to remember also that constipation is an extremely common thing that we see in children with AGS. And again, this goes along with the motility issues that we're going to see. We know that achieving feeding tolerance is going to be very, very difficult until and unless we manage constipation. When we're taking that approach to managing constipation, we want to remember that sometimes we may have to slightly overshoot the mark in order to ensure that we are actually allowing the colon to be able to clear out, to be able to evacuate, so that we can achieve better feeding tolerance. It's not always going to be perfect. Sometimes the stools are going to be looser than what we would like, but it is better for the children to be able to have regularity of their stooling in order to get good feeding tolerance. We know that if we can keep these GI issues in balance, or we can keep a bowel regimen in place that allows for evacuation of the colon, we are actually going to have better feeding tolerance, improved reflux symptoms, and really better comfort of the child overall. We also want to remember, though, that these GI issues do not exist in a vacuum. They are impacted by many of the other conditions and issues that these children are facing, not the least of which are the neurologic and muscle tone issues, but also the respiratory and pulmonary issues. And here on our next slide, I would like to talk about the common pulmonary issues that we see in AGS. So, starting with drooling and aspiration. So, when we think about drooling, we know that this is an issue with not being able to properly manage secretions and being able to swallow them adequately. So, sometimes those secretions can aspirate into the airway and into the lungs. It's really important when we think about managing drooling and managing secretions that we make sure that we are trying to address what really is the most important problem to solve, is preventing aspiration, if that is what's occurring there. Because if our goal is just sometimes to make the drooling go away, we may actually find ourselves in a position where trying to dry up those secretions too much can actually make them too thick. And so, our goal with managing drooling and excessive secretions is really just to be able to protect against aspiration into the airway and into the lungs. Another common problem that we see in AGS is the difficulty in being able to clear secretions from the lungs or the airway. And this really comes as part and parcel with the neurologic issues that we face, particularly around the low central tone, muscle tone that we see. So it can be difficult to be able to achieve an adequate and a strong enough cough and to clear out those secretions from the lungs. So sometimes we have to have, and very often we have to have what we call an airway clearance regimen. This may include things such as a cough assist device, or using chest PT, or other medications that can help to open up their airways so that we can adequately clear those secretions out. This is a place where it's important to recognize that there is this interplay between the pulmonary issues and the gastrointestinal issues, because when we are not able to adequately clear the secretions, we can have some difficulties that can actually affect the way that feeds are tolerated. And so, if we can achieve good airway clearance, we can reduce some of the work of breathing that we see, and we can help with feeding tolerance. Similarly, when we think about some of the GI issues, especially reflux, one of the reasons why we look to try to treat reflux is not only because it can sometimes cause discomfort, but also because sometimes what is refluxed can be aspirated into the airway. If that happens, that can actually lead to inflammation of the airway, and this can affect breathing and work of breathing. So you can see how these interplay. They can work against each other, or they can work with each other, and we want to balance out our approach to managing these. Another common problem that we see in AGS is obstructive sleep apnea. Again, this can get back to having that low central tone where you may have actually obstructions within the airway. This is managed at times with use of positive airway pressure, such as CPAP or BiPAP. Sometimes we may have to look at the airway and see if there's other things that we need to do to help to address any airway obstruction. When we are using therapies such as CPAP and BiPAP, we are working with a pulmonologist who is skilled in these conditions, but we also want to think about the fact that that positive pressure can also lead to some air being swallowed into the stomach, and that can affect our feeding tolerance. So we need to think about what our strategy is going to be to help to vent that air out of the stomach and help the child to be comfortable in releasing that air. So again, you can see this interplay that takes place. And we also, in some children with AGS, there can be progression to respiratory insufficiency where the muscles associated with respiration are not able to achieve the proper gas exchange that we want children to have in order to exchange oxygen for carbon dioxide. And so the strategies that we may utilize there in partnership with a pulmonologist may sometimes include non-invasive ventilation such as CPAP or BiPAP, and sometimes other strategies as well. So moving on to our next slide, I think one of the big pictures that I want to reinforce is it's really important to make sure that we think about and talk about our goals when caring for children with AGS. So, when I'm working with families, one of the things that I like to ask is to really help me to understand what are a family's goals, what are the most important priorities, and knowing that those goals and priorities may change over time, and there may be multiple of them, and that's okay. But knowing what those goals are, knowing what those priorities are, really helps me when working with families to achieve shared decision making. So, when we are working together in partnership to make these decisions, I can help to support families. Healthcare providers, physicians can help to support families in making the best decisions possible for children, knowing that we may not always be able to achieve perfection, but we can really focus on trying to achieve the goals that are most important to our children and their families. I would like to thank you so much for the opportunity to speak with you, and I look forward to being able to answer any questions that you may have in our question and answer session. Thank you.